let's talk about the grid. A grid essentially is 12 boxes that you will put on the back of your PCS form during your exam that will help you to organize your PCS. So this is my PCS, let's say. I have a patient that is 92 years old. She came in because she fell down. She has a history of Parkinson's, falls, and PVD. She's allergic to penicillin. And I'll probably put here too the patient's name, Mrs. Smith, let's say. Okay, I know that some people like to put there the entrance, what they're going to do at the beginning, as soon as they walk in the room, but I didn't feel that I had to do that. All I did was remember I was going to walk in, introduce, wash hands, ID. Walk in, introduce, wash hands, ID. And I remembered. Okay, so now I have it set up where I put my 20-minute check here. All right, I have my vital signs, my medications, and then whatever it is that I'm assigned to do, okay? And also, I like to put a box here that says RN, which is going to be the questions that I ask the RN about my patient in order to get information about them and formulate my care plan. Then also I have another box here that says safety, which I have to remember to do safety, okay? So let me go over it very quickly. I'd like you to know that it is not necessary for you to put what your letters stand for from your mnemonics, okay? Only put the letter, okay? Because if you put what it stands for, you're not going to have any space to document any abnormalities. The abnormalities are important for you to know and be able to document in the evaluation phase, okay? So, and besides, by the time you test, you better know what these letters stand for, okay? If you don't, you're in trouble, okay? So, we have the 20-minute check. What I did when I tested was, if something did not apply to my patient, I just put a line through it. So in this case, my O and D, I put a line through it because it doesn't apply. My O is for oxygen rate, and let's say my patient's not on oxygen, doesn't apply. And my D is for drainage, patient doesn't have drainage, I went ahead and crossed it out. My I stands for IV. Now, my patient has normal saline at 50, so I wrote that here, and I'm assigned I and O's. So I don't know if you can see it well, but I have a box there. This box, what I did was put boxes where I needed to remind myself to do something before I left the room, or if I had a reassessment or something like that. So this reminded me, oh, I got this pending, I better do it, all right? So I put my little open box there because this I'm going to address at the end of the PCS. All right, so then I have my vital signs. Now you may or may not do vital signs after your 20-minute check, okay, it depends on the situation. But what I like to do is put my baseline vitals here, and then as I get my vitals, I put them here. Then I could compare and see if there's something significant to then notify the primary nurse of, okay? Of course, you're not just going to write the vital signs on your grid. You have to write it on the last page of your PCS form, right, where it says vital signs after the narrative notes. You're going to put them there. You're going to circle whichever you're going to declare, and you give it to the clinical examiner, okay? All right, so now my next box says meds, medications. I have to give Cinemed at 8 o'clock. You have to remember that you have to give your medications because you're going to go and do your entrance, you're going to do your 20-minute check. You may still have 20 minutes before you can give your medicines, right? So you may go and do something else. So put a box or a star or something to remind you that you have to give those meds. The clinical examiner is not going to tell you, hey, come on, let's go, it's time to give your meds, okay? All right, so I have my medications there. If you notice, if you can see it, I have a T where it says medications. My T stands for teaching. I have mnemonics that I try to keep kind of short and sweet. And the reason why I do that is because you're supposed to know what it is you have to do. You cannot just rely on mnemonics, okay? Mnemonics are triggers. This is to remind you, all right? So my T stands for teaching. I have to remember that I have to perform or educate the patient about the medications that I'm going to give them, okay? So I did the same thing here. This is comfort management. So I have a T up here. So this is reminding me that I have to do teaching, okay? So if you see here, I have comfort. This is my mnemonic, A, do, and R. I know that I have to assess using the scale, and I also have to assess the patient's comfort preferences, all right? So I know that. So I will do that, and let's say my patient rates her comfort a 3. And the patient says that she's cold, it's very cold in the hospital, all right? So I'm going to do, right? I have to do, for comfort, I have to do 2 interventions that can help the patient be comfortable, right? But I'm going to write 3 here, just in case the patient decides to refuse an intervention. So I have a backup, all right? So here I have thermostat, so I'm going to adjust the thermostat. I'm going to provide the patient with a back rub, and I'm going to give her an extra blanket, okay? So let's say I do I adjust the thermostat and I give her a back rub. Then I will write here my result for my reassessment, and look at this. After my interventions, my patient is rating her comfort a 7. That's wonderful. So I'll put 7 here. So now this information I'm going to use in the evaluation phase, okay, to document. So make sure you write down whatever it is the patient is rating their comfort as, or any values, lab values, or anything like that, okay? You don't want to forget. All right, so PNVM. I am assigned to do what I put here, lower extremities. So all I did was put an arrow going down, okay, to remind me that I have to do the lower extremities. You have to do what is assigned, okay? And look, I have a T here. The T stands for teaching. I have to remember to do that. Also, my mnemonic is primit 2. My 2 down here is what? That's my interventions. I have to do 2 interventions that can help with this patient's circulation, right? So I put my 2 interventions here to remind me when I go in the room of what I'm going to do. In this case, I'm going to elevate her legs with a couple of pillows or a pillow, and I'm going to encourage the patient to do foot pumps. All right? Great. So now my next one is musculoskeletal management. I am assigned to reposition this patient. So where it says A, that stands for activity, I put reposition. All right, so I know what it is I have to do. Also, I have a T up there in my box, reminding me that I have to provide education to the patient related to musculoskeletal management. Okay, so if my patient has any devices, I would write next to my D whatever the device is, right? My I stands for ice or heat. If I'm assigned to apply ice or heat, I would go ahead and note it there. All right, so we have also here where I wrote RN. Now this stands for questions that I'm going to ask during report. Now you may get report from the registered nurse or from the clinical examiner, all right? So I put here pain. I know that we won't be assigned pain management, but it's good to know if your patient has been complaining of pain. So I would ask about pain with every patient, okay? So I have pain. I'm going to ask about comfort. I'm assigned comfort. I'm going to ask about this patient's mobility status, right? How is she repositioning? Is she strong? Is she weak? Is she able to move all of her extremities freely and without difficulty and so forth? Also, I'm going to ask, because I'm assigned PNVM, I'm going to ask about circulation and ask about her pulses, the refill, the temperature, edema, and so forth. So asking these questions is also going to help me to form my plan of care, right? So I'm going to do my grid as I'm gathering my information from the computer, the chart, whatever it may be, okay? I'm doing my grid. Then I'm going to find out if there's any abnormalities that are within my areas of competency, and also ask my questions to the RN and find out if there's abnormalities, and then do my care plan, okay? So that's our grid, but I want to mention one other thing. You have to know how to do a grid, right? Write it out. But also, you have to know how to use it. Many students, oh yeah, I could do a grid, I'm going to write it, and oh, no problem. And some of them don't even know what their mnemonics stand for. You better know what these mnemonics stand for. You don't have to write it out during your exam and take time or anything. You have to know what the letters stand for. Don't write them in the box, and organize your PCS using the grid. So for instance, first thing I'm going to do is walk in, introduce, wash hands, ID, right? Then I'm going to do my 20-minute check. right? I'm gonna do whatever applies, right, with my patient. So, after I'm done with this, I can come right here and do my vitals. Unless, let's say you're assigned a special assessment. Let's say you have to give the patient a hypertensive medication. And it's not 30 minutes before the meds are due yet. It's, let's say 40 minutes or 45 minutes. So you have to hold off on the vital signs. Why? Because if you do it now, then you're going to have to do it again prior to giving you medicines, okay? But let's say we don't have to give any hypertensive medications. So I did my 20-minute check. I do my vitals. I have my baseline vitals here. I'm going to write in my vitals, okay, whatever I get. I'm going to circle whatever I'm going to declare, and I'm going to remember to write this in the last page of the narrative notes section where it says vital signs, okay? I'm going to circle what I'm going to declare and declare it to the clinical examiner. Then I have my medications. I have a box here that reminds me I have to give the medicines at 8 o'clock, okay? I have to make sure I do that. Now, organizing this, if I want to do it just like that, fine. But it may not always work that way, okay? You may go in the room and do this and get interrupted and then have to leave the room, come back in, find the patient's uncomfortable and go ahead and make them comfortable and then do your vitals and so forth. So remember, it may not go as planned, but we want to try and plan our PCS, okay? Now, another thing very quickly is that I want to show you some students will put a number next to their boxes, okay? So we're going to, of course, walk in, introduce, wash hands, ID, and then we have to do our 20-minute check because this needs to be done in the first 20 minutes of the PCS, right? That's why we call it 20-minute check. It's actually fluid management, right? So some students will do this. They'll put a number and say, I'm going to do this first. And then they'll say, I'm going to do this second. And then they're going to do comfort third. And then they'll do meds fourth. And then PNVM fifth. And musculoskeletal management sixth. Okay? Some students do that and they try to do it in that order. Alright? Some students will put a box here like this. And once they covered all of the critical elements, they covered this, 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 that, then they will check it off. Okay, so you can't put a box in the corner. Once you're done, check it off, and then you don't have to refer to it anymore. All right? Others like to put a line through it. I didn't like doing that. I didn't do that at all. Okay? Some put a line through it. So whatever method it is that you find that works for you, please use it. Because remember, this grid can save you. If you miss a critical element of an area of competency, you can fail. And you really don't want to do that, right? You work too hard to get this far. So please use the grid during your exam.